All right, this is season 1 of things you should never do in anatomy. Now, I read this out to you, see arrange it, and pattern of what each of these things is for. Watch this video not just to the end, uh, continuously, gradually till you reach him, because I will be depositing the application of some of these things to the video. And this video, we are going to be looking at the diaphragm, starting from where we ended as the insertion of the diaphragm as a musculofibrous partition between the thorax and the abdomen. First, me without clear goals. Okay, never ignore the basics as the bone, the and the terminologies, the term. Never study passively. Be active and engage. All right. Never postpone revision and regular practice. Never get confused between left and right. Never neglect diagrams, labeling, and sketch. Never get distracted by phones or social media. Never panic before exams or during dissection. Okay. Next one, never cram. Okay. Never cram at the last minute and expect to remember. Never overlook clinical correlations. Never sacrifice sleep for late night cramming. Never be careless during dissection or handling specimens. Never disrespect cadavers or lab instruments. Never hesitate to ask doubts or seek help. Never ignore past question and exam patterns. Never compare yourself with others. Never study with poor posture or unhealthy habits. Never lose consistency and motivation. You follow? Okay. So like I said, in between, intermittently, we'll be looking at some of this little by little as we study our diaphragm and where we get into. Do you follow? All right. Thank you very much. Drop in the comments which of these never are the things that you want to say one or two about, or you want us to explain further about. Okay. Let's dive into diaphragm. Okay. All right, welcome once again. Like we said, we want to start with where we ended yesterday, diaphragm, which is the insertion of diaphragm. We want to say that diaphragm, we said, has three origin. Okay, CVS. And we say CVS because you're going to be used to CVS in your physiology. It's called cardiovascular physiology or CVS PIU. Short form for cardiovascular is CVS, and short form for PIU is for physiology PIU. Okay, so C there is for coastal origin, and then V is of vertebral origin, and then S, okay, is for sternal origin. And the sternal origin we say is the xiphoid process, okay, by the two fleshy slips from the posterior aspect of the xiphoid process. So the back of the xiphoid process, okay, is where the diaphragm also have one of its origin. All right, the inner surface of the lower six ribs with respective cartilages interdigitating with the transversus dominis. We have said that. And then we said the vertebral origin of vertebra has two screws. All right. The first screws is the right screws, and that, okay, is from the muscular left. Okay, it is longer also from the muscular, uh, also more muscular than the left. Okay, the right cruise is more muscular than the left, more stronger than the left. Okay, and it's from where the L1 to L3. All right, the body is an intervertebral intervertebral disc of L1 to L3 vertebra. Okay, while the left cruise, please don't forget we've started internalization and we are going to take it slowly, little by little, till we catch it. Do you follow? Remember, they said without understanding. Don't memorize without understanding the structure. Are we together? Do you follow? All right. Okay. So we said diaphragm. Okay. Introduction for anything you want to study in anatomy, any structure and any region, whether structure or space or fluid, okay, we said you must introduce it first. After that, you give a diagram, sketch something. It doesn't need to be like an artist, someone who is studying finance. Sketch something and label. 5 to 10 labels is okay. And then for the introduction, we said diaphragm is CPS from GPS. What is CPS? Chief respiratory muscle. P for one is a passage way for structures in and out of the thorax. And then the S one, we said it is the diaphragm separate the thorax from the abdomen. And then we talk about the opening, say VOA, major opening, minor opening. We are still going to touch that. For the major opening, we said vertebral opening, esophageal opening, and aortic opening, meaning there's an opening created by what? The vertebra. There's an opening created by esophagus. There's an opening created by the aorta. Okay, and then the minor opening, we said C S M S. CSMS. That is, there's an opening created by the superior epigastric. Okay, there's an opening created by the there's an opening created by the musculophrenic. There's an opening created by the what? By the greater and lesser splanchnic, okay? Greater and lesser splanchnic nerve, okay? Each of the each cruise of the diaphragm is pierced by the greater and lesser splanchnic nerve, SSS, SMS, SSS. That send message to SSS, okay? So the first S there is the splanchnic nerve, splanchnic nerve. greater and lesser, okay, splanchnic nerve. Okay, then there's another one by hemiazygous nerve. Okay, hemiazygous nerve, the H is there. She SMS, eh, SMS. We're coming to somewhere, and then we talk about the sympathetic trunk. All right, there's a one that passes, that is created by the sympathetic trunk, okay, behind the medial arcuate ligament. Now the subcostal nerve. So um we have the splanchnic, we have the sympathetic trunk, we have the subcostal, okay, we have the superior epigastric, we have the musculophrenic. Okay, we also have the hemiazygous. You can see it. Also have the hemiazygous. Okay, all right. Now, there's something I want us to learn today because we will need it when we are studying the pelvic, and that is Mogani, foramen of Mogani. Right now, they said a superior epigastric vessel and some lymphatic, okay, vessel pass between the origins of diaphragm from xiphoid process and 7 costal cartilage. Xiphoid process, okay, and 7 costal cartilage. All right, 7 costal cartilage. Okay, this is a lateral opening. Opening is lateral, okay, bilateral to the xiphoid. I remember we said the diaphragm also, okay, attaches, okay, to the posterior part of the xiphoid process. Okay, now that's that about that. That's that about that. The things that allow the opening, there are 5 things. SSS, SSS3S, okay, SSS, SMH, SSS, SMH. Okay, for me it should have been she, SMS, SMS, okay, say SMS, SHM, she, SMS, SSS, something like that. But you know they're about. Okay, let's put it this way. We have greater splanchnic nerve, lesser splanchnic nerve, hemiazygous nerve. Okay, so let's put it, STB, each cross of the diaphragm is pierced by greater and lesser splanchnic nerve. Okay, so let's put it this way. Capital S, So we are making progress, and we said for the minor opening we have SSS-MH, SSS-MH. Okay, so let's continue. We are still talking about the opening. You say for the minor opening, there are some structures, okay, that create those openings. Some structures that create those openings, okay, through the diaphragm, okay, through the diaphragm. One of those structures, we use the thing SMS, SMS. We like SMS a lot. Okay, who doesn't sending text or sending chat? So SMS, all right? So SMS, all right? SMS, 1, 2, 3, all right? SMH, 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 SMH. Okay, so let's put it this way. SMS sham, sham SMS. Let's put it that way. Okay, so it will make easy for us. SMS, sham SMS. So H small a m. Okay, yeah. So this will help us talk about the minor opening. All right. So the S is for the subcostal nerve. The HA is for hemiazygous vein, and the M is musculophrenic. Okay, musculophrenic. Musculophrenic nerve, okay, musculophrenic, not really nerve, but vessel. So it could be the artery. You get it? Could be the musculophrenic artery. Okay. Uh-huh. Now the next thing is we've talked about subcostal. So why me as then the next thing is the superior epigastric vessel. Okay. Then we also talk about splanchnic nerve, both the lesser and greater, okay, splanchnic nerve, okay. They are the one, two, three, four, five, six, six things that passes through, or seven things that passes through, or create a minor opening, okay, on the what? On the diaphragm. Okay, so the next thing we're looking at was the okay, we've not looked at origin depth. Okay, we look at uh origin and insertion, not relations, rather origin and insertion. Okay, so for the origin and insertion, we said, so for origin and insertion, diaphragm has three origins: CVS, C for coastal origin, V for vertebral origin, S for sternal origin. The sternal origin, you said it at the side for the posterior part of the xiphoid process, okay? And then the coastal origin said is from the internal surface of lower six ribs, okay? That's surface of the lower six ribs, or coastal cartilages of the lower six ribs, okay? That's what we talk about for the origin, okay? Said the coastal surface from the inner surface of the lower sixth rib with respective cartilages. That's why it's called coastal origin. Okay, all right. Then we look at the vertebra. This vertebra, see how we are looking at it and touching and explaining, because the body is the best textbook. So don't just look at diagram, try to touch. If you can tap yourself, you can understand anatomy. Do you follow? And we say be consistent. Don't compare yourself with someone. Whether somebody joins you to study life or not, whether somebody, listen to what you said or not in the studio, no. You are consistent. Whether somebody knows better than you or not, consistent. Consistency beats the talented. One day, consistency will beat the talented. You may not have a foundation, may not have gone to best school, good school, whatever. Forget about that. All right? Focus on consistency. Show up like we show up. We know there are a lot of things that hinder us from showing up like we are showing up. You think it's easy for us to run three things and see, it was a goal. That's why we say never study anatomy without a goal. That's the first thing we said. Never study anatomy. For me, for example, I said I want to look at this anatomy from that 15th of July till the end of July. So be consistent. All right. A lot of things will challenge your consistency. As a matter of fact, when you make a decision, the devil will bring distraction. He may not destroy you, he may not confront you, but he will bring distraction. That's why we said never do this in anatomy. Number one, never be inconsistent. So you are consistently setting a goal, like we said, want to look at this concept, want to look at this thorax, want to look at this abdomen, want to look at this pelvic, want to look at this perimeter. And I can tell you, I have done that. Okay. Now, have I learned all the details, all the textbook, all the videos in the whole YouTube? No, but I've started something. I can say a little thing about each of those things. That's why I'm bringing in other areas, other subtopics. Are you seeing? So consistency is the big goal. Next thing we are talking about is we've talked about the minor species, the minor origin. We said SMS sham or sham SMS. Hello sham SMS. SMS sham, mini SMS, and things like that. Okay, don't lose your motivation. Okay, you're hungry, turn the hunger to success. Hunger for success, not for food. You never be remembered for what you've consumed, but for what you contribute. Moving away from there, okay, we talk about the origin. We said there are three origins. Okay, C, V, S. You know of C, you know of S. This V is the one we're talking. There are two, right and left. You said the right is more muscular and longer. Okay, it's more muscular and longer compared to the left, origin. And then moving away from there, we said this structure called the right is from the bodies, okay, the anterior front, okay, bodies and intervertebral disc of L1, L2, and L3. Now, talk about the left. We said the left has um, three origins. Okay, has three origins. So the vertebra has two, right and left. The right is more muscular and longer from the bodies and intervertebral disc of L1, L2, and L3. Okay, yeah, can see the intervertebral disc, can see the right cruise, can see the left cruise. Okay, so you can see the intervertebral disc in that diagram. Okay, so now we said the left now. The first part is that the left originates from the bodies and intervertebral discs of L1 and L2. Did you see what is happening in the structure? Look at the structure. This is the left cruise, L1 and L2. But for the right, L1, L2, and L3. Can see it? Something that looks like branches, 1, 2, 3. Whereas for L2, the left cruise is the left cruise. Follow it, follow it. Okay, it's only on 1 and 2. Okay, so that's why you study, touch it, you study, touch it, you see it. All right. Now, this will make more sense when you now get cadaver and say, oh, let me see either the synthetic or when you are dissecting. Okay. Now we are storing it slowly. We are making sentences over and over, and we'll make need of these things again. So the left, we said, is what? We have the first one that is from the L1, that is from the bodies of L1 and L2. That is the bodies and intervertebral discs of L1 and L2. Okay? Now, the next one is another one from a pair of medial arcuate ligaments. All right? Pair of medial arcuate ligament. Call it POM. Pomal. Pair of medial arcuate ligament. There's another one from pair of lateral, okay, arcuate ligament. So that one we call it polar. So we have pomal, we have polar. Now you see how many these things are. That's why this thing has to be done bit by bit, little by little. Do you follow? Okay. We're making progress. And we said that's for the left cruise. Okay, that's for the left cruise. See, left cruise of diagram. I see the medial arcuate. I see any now. And we say it's from pairs, both side. Okay, both side. All right. So let's continue making progress. So we now say, talking about this now, we said we have the origin. So in a nutshell, what's the origin of the diaphragm? 3. CVS. The one that says seems to give most stress is vertebra. That one has two screws, left and right, ra or la, ra, R-A-L, la, L-A-R. So depending on which one you're looking at. So we said the right screws, okay, originate from the bodies, the front or anterior bodies and intervertebral disc of L1, L2, and L3. Whereas the left screws, okay, originate from the L1 and L2 only. Now there's another origin from the pairs of medial arcuate ligament, pomal, and there's one from the pairs of lateral arcuate ligament, lateral arcuate ligament, polar. Now let's color that a little. Now when that happened, they insert at L1 and L2, always L1 and L2. Now, instead of just bodies and intervertebral discs, this one inserts on the side of the body and lateral to the tip of the transverse process of L1. Lateral to the tip of the transverse process of L1. The same thing with the medial, the lateral arcuate. Okay, it inserts, okay, lateral to the bodies and the transverse process, the tip of the transverse process of L1. So we are back to this again. We said, spending some time to know the origin and the insertion. So the origin we said for the diaphragm, we have been saying this and we keep saying it. And you should also keep saying it, keep seeing it, keep stretching it, keep checking it, keep checking another material. What you should never do in anatomy is to read only one source, is to listen to only one thing, is to learn in only one means. You need to try all the possible. Don't say, I'm not the type that read at night. Oh, don't say, I'm not the type that read in the day. You must learn to do, because if you don't learn it, anatomy will lead you to it, will bend you to it. Okay? Except you don't want the kind of success that's enviable. All right? Except you don't want to pass this thing. Okay? But to pass it on, it needs passion. P-A-S-I-O-N, pass, I on. Okay, so remember we said the origin is 3, is 2 for vertebra, 3 for origin. The 2 is right and left. The right cruise, you saw the right cruise in the diagram. It is more longer, it's longer and more, you can see the length, see the length, see the length, and see the length. This one is longer, this one that look like beside this yellow something. This side, the yellow tube and the red tube are the same. And this one, the yellow tube is longer than the red tube. Those are the insertions. Insertions. Okay, that insertion is on the vertebra. On the vertebra. L1, L2 for the left, L1, L2, and L3 for the right. And we said that right one is longer, more muscular. But the left one is smaller, but has a lot in them. The first thing you see there is that the left originates from the bodies, okay, and intervertebral disc, okay, of L1 and L2. That's number one. Number two, it also originates from the pairs of medial arcuate ligament, we call it pomal, which later inserts, okay, on the side of L1 and the tip of transverse process. Are you seeing it now? On the tip of transverse process, okay? Side of L1, sole top. Sole top. Okay, so it says sole top. So you learn anatomy smarter. Okay, sole top. So that's what happens there. Then the next one is we have, tomorrow now, or is it tomorrow in the afternoon, I'll be rattling through this. And somebody will be watching, is able to say all this. Watch the video so you see how we say all this. See how we always said, what you should never do in anatomy. See, you should never do, when something serious, you remove your eyeglass. You should never do this in anatomy. You should never do this for any reason. You should never ever do this in anatomy. Don't try it. Never do this in anatomy. Never do this in anatomy. Never study without strength. You should study this thing and study it well. Pay more attention. Watch it, stretch it, check it. Now, for the lateral, we have the lateral. There's a one from the pairs of lateral arcuate ligaments. Once again, it inserts by the side of L1 and L2 and the tip of the transverse process. Sole top. Side of ligaments L1 and L2 and then tip of transverse process. Sole top. That's what we said. Okay? Yeah, that's what we say. You say it over and over, it's going to stick in. Do you follow? All right. Then we move on to the next one. Okay. There are a lot of information there, but just the one that is needed is the one we are using. Okay. When you come to check the diaphragm again, it's going to make sense. Now let's look at the insertion. Do you notice insertion is not difficult? It said anatomy insert at the central tendon situated in the middle depressed part of diaphragm near the sternum. At the central tendon, that's the insertion. Situated in the middle depressed part of diaphragm. middle depressed part, diaphragm, near sternum. Okay, near the sternum. And that's not very clear because you know the sternal origin is from the posterior, the posterior aspect of the xiphoid process to fleshy slip. Okay, now this one now is the insertion. So it inserts at the central tendon. So let's check what is happening here. You can see central tendon. Good. See central tendon. Vena cava opening. Do you see it now? Check. Are you seeing what is happening? That's the central tendon. Okay. Central tendon is situated in the middle depressed part of diaphragm near the sternum. So something to find out. Central tendon. Where is the central tendon connected to, attached to? Okay, is it a bone or is another structure? All right, we'll take a little break of 5 seconds and then we come back to this again. All right, so we are here again. Needed to take a sip of water. This is anatomy. Study, stand up, stroll, come again. That's how you do. Take a little, take a break, come back again. A little here, a little another time, a little another place, a little from another video, a little from another, like that, like that. It's accumulating. So now we are looking at the openings of the diaphragm. Don't forget where we are coming from. Okay, we ended by saying that the insertion of the diaphragm is on a central tendon. Okay, central tendon is near the sternum. Okay, central tendon. And the opening we say pomal, stotop, and then pala, sotop. Polar, sotop, palmar, sotop. What does that mean? Anatomy, the vertebral origin is inserted on the pairs of medial arcuate ligaments, okay, and then which is by the side, which passes to the side of the L1 and L2 and the transverse process. Okay, and the tip of their transverse process. Okay, tip of their transverse process. You need to know what the transverse process is. Don't worry, when we look at the anatomy of the thorax again, we're going to see that in the afternoon, we're going to see the transverse process. Okay, transverse process. All right. Now, also said that there's a one for the base of the lateral arcuate ligament, once again, okay, which passes to attach to where which passes to attach to where it passes to attach to the side and tip of transverse process of the L1 and L2. As I said, pala, sotop. The sole there is side of L1, top there is transverse, okay, tip of transverse process, TOTP, tip of transverse process, TOTP. Okay, this is tip of transverse process. You see now, and then sole is side of L1. That's the first lumbar vertebra. So as you're studying, study that same way. You're tired, stand up. Okay, you can make water touch your cervical plexus. All right, Guess what we said? That's another way you check tiredness and sleep. Can do exercise if you must, can stretch if you must, can yawn if you must, take your water if you must. Okay? And guess what? You continue. But if you want to lie down or rest, remember abdomen RES, R for radiography appearances, E for extent, and then S for what? The surrounding structures. Okay, so when you want to rest, tell 3-4 persons to wake you up physically, not just on calls. Because if you don't know that, if you don't keep those measures in place, the treasured knowledge you need to acquire in the given period of won't be possible. And as you move on, more things are expected for you to know, to be able to be the kind of well-becked professional you need to be. And guess what? You will be it. See you at the top. Okay, so we move on to the openings. You have the major openings, you have the minor opening. Okay. The major opening include the vena cava opening. Number 2, oesophageal opening and aortic opening. That's interesting because I've been thinking vertebral opening. No, it's vena cava opening. See the opening here. It's a major vena cava opening. Are you seeing it now? A major opening. It's even opening on the central tendon, which is the insertion of the diaphragm near the sternum. Near the sternum. Okay. Another opening is the esophageal opening. Okay, see the esophageal opening here. You can see esophageal opening. And see aortic opening. See? That's the aortic opening. All right, so you study anatomy with structures, study anatomy with diagram. All right, let's move on. Can you even see they even bring it out here? Esophageal opening is around T10, the aortic opening is around T12, and the vena cava opening, okay, is around T8. Okay, so voila. Vena cava is T8, esophageal is T10, aortic opening is what? T12. Okay. So it skips by 2. It skips by 2. Okay. So the next thing we want to look at, if you look at the opening, we already look at the minor openings where we say sham, SMS. Sham, SMS. So SMS sham, that's text sham. What's the sham? H, and M. The S there is the splanchnic nerve, greater and lesser splanchnic nerve. The HA is hemiazygous nerve, vein rather, and the M there is musculophreno. Yes, musculo. Is it sham SMS? They can sham SMS sham. 1, 2, 3, 4, 5, 6. Okay. SMS sham. And so we say sham SMS, then it's you have only one M there. So SMS sham, SMS sham, SMS sham, something like that. Okay. And then moving away from there, we said we have the S is for splanchnic, greater and lesser splanchnic nerve. Okay, and then the HA hemiazygous, and then the S there is subcostal, subcostal what? Subcostal vein. Okay, subcostal vessels, and then M is the musculophrenic vessel. S there is superior epigastric vessel. These are vessels. These are vessels. Some of them are arteries. Okay, yeah. So, see now, subcostal nerve and vessel, meaning it's not only subcostal nerve. Remember, we talked about subcostal veins. Okay, the ascending lumbar vein empties into the subcostal vein. Okay, so let's continue. Now we are done with the origin, the opening. Okay, done with origin, insertion, opening. I want to look at the relations. I want to look at the relations of the diaphragm. There are two relations, superior and inferior relations. Okay, superior and inferior relations. The superior relations, okay, is the pleural and pericardium. The pleural and pericardium. Pleural are the two membranes that covers the two lungs. Pleural for singular, pleurae for plural. Please, if you don't understand, you don't understand. Plural is the English opposite of singular. Now, plural is the singular anatomical word for a singular membrane that covers the lung. Now, pleurae is the plural of the membrane that covers the two lungs. Do you follow? Thumbs up if you follow. Drop in the comment section if you follow. Okay? And if you're with us here, I want you to join us, okay, to indicate so that we guess you in our evening session. Now, evening is always night where people are tired and sleep. So what do? We like discussion. In the morning like this, we like sensitization, repetition. And sometimes in the afternoon, we teaching too. But majorly morning and afternoon, we like teaching using screen recording, live session, live streaming. Okay? Believing you are repeating after us. Now, and then in the night we do the other part. Now, a time will come maybe in August, we'll be teaching from material, and guess what? We'll also be bringing in guests. Okay? So that we can have more guests every now and then. Okay. Now, we've talked about superior and inferior. The superior relation is the pleural and the pericardium. The pleural and the pericardium. Okay, the pleural and the pericardium. Do you follow? The next thing is the inferior. We have the peritoneum, the liver, fundus of stomach, spleen, kidney, suprarenal gland. So we are going to do it in such a way that we'll appreciate what is happening there. Now, the relations we have PSP. And then for the inferior relation, we're going to have another thing. Okay? Inferior relations, we're going to have, we have the okay, how do we do this? We have P, we have, the other one is PSP for superior, the one is SPS for inferior. All right, so we still have KLF. KLF. Okay. KLF has the liver. Okay. The liver, the kidney, and the fundus of the stomach. Okay. How do we do that? PSP for superior, SPS for inferior. The inferior also have the KLF. KLF. All right, how do we do this? Like kid, like father. kid like father. SPS, kid like father. Let's put it that way. Kid like father. Kid like father. Kid like father. Alright, we move on. Don't forget where we are coming from. We say relations is two, superior relations and inferior relations. And then talking about the superior relations, we said we have the plural and we have the pericardium. For inferior, the PSP. PSP. This one is SPP. Okay. And that even makes more sense. Okay. That makes more sense when we said SPP. Okay. Makes more sense when we said SPP. So SPP, kid like father. So let's say kid like father, SPP. Meaning this is a species or a generation where the kids are like fathers. Where the kids are like fathers. If the kids are rich, if the fathers are rich, the kids will be rich. If the kids and fathers are not rich, the kid will they be rich? I leave you to answer that. Okay, so moving away from there, we've done a whole lot today. We've done origin, we've done insertion, we've done openings, major. Okay, we said it is vena cava opening, not vertebral opening. I have been singing since. Vena cava opening. Okay. And then we have SMS SHA. SMS SHA. What does that mean? What that means is you have SMS SHA. What that means is that you have the greater and lesser splenic nerve, the musculophrenic vessel, subcostal nerve and vessel, superior epigastric vessel, hemiazygous vein. Do you get? They're all vessels, nerves and veins and arteries. Now let's look at arterial supply. Arterial supply. We're almost getting into an hour of this study. Trust God we should be able to finish diaphragm this morning. So arterial supply, we said USLIM SUP. You slim soup. You slim soup. That's what we said for artery. What does that mean? U for upper 3 right lumbar artery. Upper 3 right lumbar arteries. Don't forget to. The other U is upper 2 left lumbar artery. Upper 2 left lumbar artery. All right. The next one is we have the S there is superior epigastric artery. Superior epigastric artery. The other S is superior phrenic artery. Are you seeing what is happening? If it is a lumbar artery, upper, left and right. If it is superior, epigastric and phrenic. And we talk about the L now. This is the lower 3 posterior intercostal artery. Lower 3 posterior intercostal, lower 3 posterior intercostal what? Artery. Lower 3 posterior intercostal artery. So we have right and left. Right and left. So we have both the right artery and the left artery of the lower So LT, lower, lower, lower third posterior, okay, intercostal artery, LTPR, LTPR. We have the left and the right. The left and the right. The I there is the inferior phrenic artery. Remember, we have superior phrenic artery and we have inferior phrenic artery. And the M there is the musculophrenic artery. Musculophrenic artery, while the P is pericardiophrenic artery. Remember, we have pericardium and plural as the superior relations. Are you following? Thumbs up if you are with me. Okay. So moving away from there, we have, next thing we have, okay, is with that we are done with the arteries. Okay. So I'm going to say that again so that you are going to get it. We said if you are talking about the artery, you use the acronym U hyphen slim hyphen soup. Yeta U hyphen SLIM hyphen SUP. Now, okay, sir. So we move on. I said I'm repeating the artery so you can get it. Now, U hyphen, as you draw a dash, SM, SLIM, that is U slim. Then you draw another hyphen, okay? You write the SUP, SUP. So you slim soup. You slim soup. Maybe you are eating your soup, okay, and you say, this soup is slim, very slim and tiny. Okay, so that's anatomy. So each time you are eating a soup, all right, whether it's stew soup, okay, or Chinese soup, okay, or sub-Saharan African soup, okay, whatever soup you said, you remember the arteries. U for what? Upper third lumbar artery. The other U is for what? Upper left lumbar artery. Then sleep, there are two S there. Superior gastric artery. Next one, superior phrenic artery. And if there's superior phrenic artery, means there's inferior phrenic artery. And then the M there is the musculophrenic artery. And the L is the lower third posterior intercostal artery. Both the left and the right. Okay, both the left and the right. Call it LT Pia. LT Pia. Tapia Pia. Okay, so LT Pia. Okay, lower third posterior intercostal artery. And then what else is there? The P, pericardiophrenik artery. Pericardiophrenik artery. Those are the arteries that supply the diaphragm. Let's look at the venous drainage. They say the venous drainage is accompanied with arteries, and the venous drainage accompanied with arteries and drains into systemic vein. Do you understand that statement? That statement means that the arteries, okay, that supply the diaphragm have accompanying or corresponding veins. Okay, now, all those veins drains into systemic vein. Drains into what? Systemic vein. Okay, there's something I wanted us to look at. Foramen of Mogani. Foramen of Mogani. Okay, let's look at that again. We didn't look at that. Foramen, that was in the superior epigastric vessel. We said superior epigastric vessels and some lymphatic pass between the origins of diaphragm. from xiphoid process and seventh costal cartilage. The gap is known as larynx space or foramen of Morgani. So if they ask now, what's the foramen of Morgani? You say the foramen of Morgani is the space, okay, between the seven costal cartilage and the xiphoid process. This is where the superior epigastric vessels, okay, and some lymphatic vessels pass. Foramen of Morgani. Okay, foramen of Morgani. Foramen of Morgani. Like I said, it's very important because when we are talking about the pelvic, we'll soon look at pelvic again. Look at it before. You still see that foramen of Morgani is a serious anatomical landmark. It's a serious anatomical landmark. Okay, foramen of Morgani. All right. Now let's move on. We said foramen of Morgani is also called Larry space. There's some people whose name is Larry. Okay. Some people's name is Larry. So Larry space. Larry spelled, you can see it on the material, Larry apostrophe S. Okay, Larry's space. Larry apostrophe S. Okay. So where do we have Larry's space? It is between the seven costal cartilage and the xiphoid process, where the superior epigastric artery or vessels passes through there. Okay, it's a minor opening. So we said the venous drainage, it empties into where? Systemic vein. Let's look at the nerve supply. The nerve supply, there are two. We have the motor and the sensory. The motor nerve supply is divided into two, the right and left, lala or rara. Okay, the right, okay, and the left phrenic nerve, right and left phrenic nerve. This phrenic nerve is C3, C4, and C5. Okay, let's look at the sensory. Sensory is divided into two. We have the central and the peripheral. Central and the peripheral part. The central is supplied by the phrenic nerve. The peripheral is supplied by lower 6 or 7 intercostal nerve. Okay, let me pause it here and give it to you, because after that we'll be looking at actions and anomalies and we are done. So can you recall what we just said? Okay, pause the video and see if you can recall. Use a second or a minute and see if you can recall. I'm also going to pause it here and see if I can recall. That's how we learn it. Do you follow? Okay. Okay, so I hope you have gotten that. Okay, yeah, hope you've gotten that, and it's what gating. Okay, it's what gating. So now, where's my lens? Okay, so we move on. We said the nerve supply. Okay, we said let's start from nerve supply back to where we came from. Okay, but just away from that, let's take a little of the strange thing we talked about. What you should never do in an what you should never do in anatomy. Let's take a little of. I did promise I'm going to tell you some parts in it, so let's take a little of it. Now, never study anatomy without clear goals. We set goals, what we want to do. We say, never do this in anatomy. And I'm telling you now, 20 of such things. Respect the subject. The subject says, do this. Read 3 hours every day, aside from lecture. Now we are here again on anatomy. In the afternoon, we are going to be here again for anatomy. In the evening, we are going to be here again. My own goal was from 15th July to the end of July 31st. I'll look at thorax, abdomen, pelvis, and perineum, and I've don't look at them all through. Now, as I'm adding upper and lower limb, and then the next goal is by the month of August, we're going to be adding head and neck. So as you run through anatomy of thorax, abdomen, pelvis, and perineum, we add upper and lower limb, okay? And we still add head and neck. Yes, head and neck. We don't wait until you are taught. People have sent queues of material, we should study with them. And we start. So in the afternoon again, we are going to come for this anatomy. Thorax, abdomen, pelvis, and perineum again. What did we not look at in abdomen? Yes, we've looked at abdominal vessels. We look at it again. We've looked at abdominal radiographic appearance. We look at it again. The perineum, we look at it again. So thorax, abdomen, we look at it with now we've looked at diaphragm like we promised. We're going to look at lungs. And we're going to look at great vessels of the heart. Okay, we still look at it again, look at it again, look at it again, so that as we are adding upper and lower limb and head and neck next month, which we've started upper limb already, we talk about joints, talk about bones, talk about muscles. We even mentioned 17 muscles of scapula. Now we've mentioned 11 muscles of the extrinsic parts of the thorax. You see, and now we are on muscle diaphragm. It's a muscle. Watch how we are studying muscles. So what you should never do in anatomy is never study anatomy. As you say, what do I want to, like me, I say, want to complete the remaining part of diaphragm. And we're on it. Do you follow? Do you follow? Drop in the comment section if you are following. I say never memorize without understanding the structure. So as we read the structure, we tap our part of the body. We touch it. That's why it is called tap. Don't try studying anatomy if you cannot tap it. Yes. They're talking about thorax, you touch it. It's a region between neck and abdomen, you touch it. It says the xiphoid process, you touch it. So your body is the best test. That's what we said yesterday. Your body is the best test. That's the good news. So now I know between my xiphoid process and my 7 costal cartilage, there is an opening where the superior epigastric vessel passes through. And that space is called Larry's space or foramen of Morgani. I touch it, I see it. So you too, as you are doing this, you should touch it. You should touch it. That's why it's called tap somebody. Tap the upper limb, tap the thorax, tap the abdomen, tap the lower limb, tap the head, tap the neck. That's why when you want to remember something, you tap. So if you want to remember, you tap. Are you seeing how this works out? Thumbs up if you are with me. Okay? So we are soon rounding up because we end this session around 11:30. Okay, so that we take a break. We come back by 3 o'clock, 3 to 5 to build this business. Now, moving away from there, We said never ignore the basics. The basics point that we've lifted up, like now, in this opening of diaphragm, we've talked about the major opening and the minor opening. Voie, vena cava opening, that's the opening that you find in the central tendon where the diaphragm is at. Okay, you find an opening left there by the vena cava, in fact, inferior vena cava to be specific. Okay, and then you see another there by the os vagus. Os vagus, okay, send an opening that it will gonna open into the stomach. All right. Now there's something I just recall, fundus. Where did fundus come in? Fundus. I just recall fundus. I did talk about fundus. Okay. I'm gonna recall, don't worry. All right, relations. Superior, yes, it's in relations. Are you seeing it that it's in relations? Relations of the diaphragm. We said, what did we say about the relations? Kid like father. Kid like father, SPP. A generation of kid like father. What is kid? Kidney. What is like liver? What is father? Fundus of the stomach. That's the inferior upper part of the stomach. Now the SPP there stands for, the SPP there stands for what? Can you recall? The here again. Kid like father, SPP. Okay, so not SPP, SPS. Okay, SPS. The S, the kid, kidney, like his liver. Father is the fundus of the stomach. The S there is the spleen. The P there is the peritoneum. Okay, the peritoneum. Where is the peritoneum? Where you have the external genita, the reproductive organ or the excretory organ. Okay. And don't remember, we said there are two triangles there. When we're looking at pelvic peritoneum, we said there are two triangles. We have the larger, okay, the larger posterior anal triangle. And then there's smaller anterior urogenital triangle. Okay. Don't forget, those are the basics. Those are the basics. Okay. All right. Spleen. All right. Spleen and suprarenal gland. Suprarenal gland. All right, let's quickly look into something else now. Want to look at the actions of this. Don't forget, this action reminds you of the function of the diaphragm. The diaphragm is the chief respiratory muscle. It helps to pull your thoracic cage up and relax it on exhaling. Something like that. It's the diaphragm that makes that possible. And we say the most muscular part is the right crus, CRUS. It's very long. You find it in L1, L2, L3, but the left one is not that long. However, it has three special origins. Okay. So let's look at the actions now. The actions of the diaphragm include chief, principal. It says C. It says the chief respiratory muscle. Chief there means principal. Now, what else? It moves 1.5 centimeters. That's serious. moves 1.5 cm. That's why exercise is very important. Okay. The next thing is, we said it helps in breathing. It helps in deep breathing. Diaphragm moves 6 to 10 cm. Can you imagine that? It moves 6 to 10 cm. That's serious. So this is in normal breathing. But in deep breathing, it moves 6 cm to 10 cm. That's a serious stretch. So when they say take a deep breath, that's a serious exercise. Opened up by stretching it. Next one, it helps in expulsive function during acts of vomiting, micturition, that's the urination, and defecation, and parturition. So how do we call this now? MD, MDPC. So the action is MDPC. That's the personal computer of the MD. That's the action for the diaphragm. That's the action for the diaphragm. MDPC. What does that mean? M there stands for micturition. Diaphragm helps in doing that. D stands for defecation. Without diaphragm, you cannot push that fecal matter. Okay? PC, the P there stands for what? Parturition. Without diaphragm muscle, okay, to give birth is difficult. And then C there is the chief principal muscle of respiration. Okay? Now let's look at anomalies. Anomalies. That's the clinical significance. The clinical significance now of diaphragm number 1. I think we say hypia. Hypia. What's hypia? H for hiccough. H for hiccough. I for irritation. The diaphragm can be irritated. Okay. P for phrenoesophageal ligament weakness. If you're, okay, let's say, okay, we are coming to Bogdale's triangle and Bogdale's hernia. So we've seen I for IFA, okay. Irritation. All right, acquired hiatus. Acquired hiatus hernia. That's A now. Acquired hiatus hernia. Acquired hiatus hernia. Okay, HIPA first H is a hiccough, result of spasmodic contraction of the diaphragm. Then the next one we have is the what? The acquired, so we can say HIPA. Or you see, hiccough, irritation, acquired hiatus. Acquired hiatus. Phrenoesophageal ligament. When the phrenoesophageal ligament is weak, phrenoesophageal ligament. When that is weak, what happens? We discover that there's going to be acquired, okay, hiatus hernia. Okay. And one other thing is there, let's look at collection of pores may occur in subdiaphragmatic abscesses. Okay. Say HIPAC, cheaper. Okay, let's put the word cheaper. Let it be cheaper. C for collection of pores. Collection of pores. Okay. Collection of pores cheaper. H for what? Hiccup. I for what? Irritation. Okay. And the A for what? Acquired hiatus hernia. Now let's look at the applied and the anomalies. Anomalies. Anomalies are the clinical significance, whereas the applied anatomy are the normal function. Although not all applied anatomy are normal function, depends. They say sometimes the diaphragm may fail to develop. Sometimes foramen Morgani may be enlarged due to abdominal viscera to herniate into thorax. So meaning the organs in the abdomen may want to enter into the thorax through that foramen of Morgani. And when that happens, we said there's an hernia. Sometimes diaphragm fails to arise from both lateral arcuate ligaments on both sides, forming a triangular gap known as costovertebral triangle. Costovertebral triangle or Bukdele's triangle. Remember we said when we're talking about this origin, he said that the diaphragm originates from right and left cruise. Now, the right cruise, we said it is longer and more muscular from body and intervertebral disc of L1, L2, and L3. It's the longer one. Now, the left one is just L2 and L1. Both the side of the L2 and L1 and the tip of transverse process is a sole top. That's the acronym we use. Now, when this structure have done that, you also have another one from the medial and lateral. Now we are saying if the diagram fail to arise from both lateral arcuate ligaments on one or both sides, okay, what happened? A triangular gap is formed. That's what they are saying here. So that in failure to arise, for an origin for diaphragm to arise, okay, there's no contribution of diaphragmatic muscle from that lateral arcuate ligament. We have Bukdele's foramen, and an hernia can occur there. Okay, maybe a site for diaphragmatic hernia, just like the other foramen. How do you call the other foramen? Morgani's foramen. Okay, can allow some organs in the abdominal viscera to want to enter into the thorax. So what is hernia? When some herniate, okay, wants to move into. That's the hernia we are talking about here. All right. So it's 1 hour 22 minutes. So the summary of that is number one, they can be Bukdele's Delex hernia. Okay. Bukdele's foramen, which can lead to what? Diaphragmatic hernia. They can be foramen of Morgani. Morgani foramen, which can lead to what? Another hernia. Okay. Now, there's another one, congenital hiatus hernia. Congenital hiatus hernia. That is, if there is a failure of the central tendons, okay, to develop completely, can live with congenital hiatus hernia. Do you follow? So those are the sites of diaphragmatic hernia. 3 different sites. When we talk about the central tendon, if you have space there in the central tendon, okay, if there are spaces in the central tendon foramen, guess what? It's going to lead to an hernia because some structure may want to pass through into there. Say, it's paining me in my stomach. These are some of the things that may cause pain. So I'm going to run through from here now. We talk about the anomalies. The anomalies are how many? We've had the anomalies for the 3 hernias. The Morgani foramen hernia, the Bogdales triangle hernia, and then the congenital hiatus hernia. This one is by the central tendons. Then what other side thing do we have? That's all. Okay, that's all. Then for the clinicals, we said chipia, cheaper, okay, cheaper, with phrenoesophageal ligament weakness, okay, or you can say chia, chai. Okay, let's put this way, chai. Chai. You know I like saying chai. So what's chai? I for irritation, A for acquired hiatus hernia, H for hiccough, and then C for collection of pores, chai. So when we say chai, it stands a whole lot for a whole lot. Okay, chai. All right. Let's see how to round up this session now. I've spent almost this time to build this business. So let's round up this session. We started from opening, and then we've talked about opening, origin, insertion, venous drainage, blood supply, nerve supply, action, clinical significance, abnormalities. Okay, 1, 2, 3, 4, 5, 6, 7, 8, 9. You've done 9 things. I say never study, and these are the things you never do. Never study anatomy without taking tests. Let me show it to you, okay, before we run. Look at it here. I said, never study anatomy passively. Be engaged in active, recall. Okay. Also, never postpone revision. So we vision it out. We voice it out. Want to revision it. Want to look at this at it again. All right. Now, fresh page. Let's try to record the things we have learned so far about the diaphragm. Fresh page. Let's try to look at the things we have learned so far about the diaphragm. Number 1, let's start with the anomalies. The anomalies are 3. Okay, the anomalies are 3. We said chai. It could be irritation. There could be acquired hiatus hernia. There could be hiccough. There could be collection of pores. Those are the things. This is fresh page. You also do the same thing. Okay. Now, if you have not gotten it when we finish, you go through the video again. The next one we say clinicals. There are 3 hernias. Okay. You can find the one that is called congenital hiatus. Hiatus hernia. How does this one occur? This congenital hiatus hernia occurs in the central tendon. That's where the diaphragm inserts near the sternum. We've talked about the insertion. That is diaphragm insert near the sternum in the central tendon. Okay. Now we talk about the action. How do we say about the action? Can you remember what we say about the action? Okay, let's put it this way. Maturation was there. MD, yeah. Iteration was there, defecation was there, parturition was there. Okay, parturition was there, vomiting was there. Okay, and MDPV, vomiting was there, PVC, MDPVC. I think MDPC, that's what we said, but MDPVC, because vomiting is part of it. So M is micturition. That's the action of diaphragm. Diaphragm help us to urinate. Okay, they help us to defecate, help us to give better parturition, help us to do what? To vomit, help us to do what? To respire, chief respiratory muscle. So, and then for nerve supply, we say sensory and motor. For motor, we say phrenic nerve of C3, C4, and C5. For sensory, we have central and peripheral. Central is the phrenic nerves, and the peripheral is the lower C6 and C7. And we talk about blood supply. For the blood supply to this thing, we said you sleep, you slim soup, upper right lumbar artery, upper left lumbar artery and upper right lumbar artery, superior epigastric artery, superior phrenic artery, inferior phrenic artery, lower third, look at it, lower third posterior intercostal artery, LTPR, Otapia. And then we talk about the eye. M is musculophrenic artery, P is pericardiophrenik artery. Venous drainage, okay, are the corresponding veins of these ones we mentioned, like the BCS and this one. So we say that is for what? It all drains into the systemic vein. And then for the insertion, central tendons. For the origin, there are 2 origins. For the origin, there are 3 origins. Rather, we said the CVS. Okay, CVS, the costal, the vertebral, and the sternal origin. Sternal origin is at the posterior part of the xiphoid process. The vertebral origin has 2 cruise, the right cruise and the left cruise. The right cruise is the longer and the strong. It has L1, L2, the bodies and the intervertebral discs. And then moving away from there, we said I'm saying this because my battery will soon go down. I need to find a way to charge it. Okay. You listen to it slowly. We've been taking time to study and plaster it slowly. Now we are saying it very fast because we have gotten it small. Okay, move on. The left cruise is that divided into 2, right? Is divided into 3. That is the one from the bodies and intervertebral discs of L1 and L2. One from the medial, we call it mopal sole top. Mopal sole top P. Okay, that is medial opening, medial of posterior, and how do you call it? Medial arcuate, medial arcuate ligament. Okay, medial arcuate ligament, lateral arcuate ligament. Okay, lateral arcuate ligament. Then we say the side of L1 and the tip of transverse process. Now we move on. We talk about the opening. Voie, that's the vena cava opening, esophageal opening, and the aortic opening. Those are the major opening. Minor opening, we said SMS, that is the splenic vessels, okay, greater and lesser splenic vessels, the musculophrenic vessels, okay, the subcostal nerve and vessels, the superior epigastric vessel, the hemiazygos vein. Those are what we have looked at today, ladies and gentlemen. Thank you for being a part of this session. It's been 1 hour 32 minutes. This is MSC Mastery channel where we learn in piecemeal. This session we are learning this way. Another session will be learning another way. 3 o'clock session is the afternoon session or this session. Please don't miss it and don't forget to be a part of it. The night session is a session where we have our guests. This is a month of tap it and get it. Upper and lower limb, Head and neck, thorax, I will be fine. See you at the top. Okay, bye bye for now.